So I'm going to do a demonstration. I'm going to do some poses on the chair. And the reason I'm doing this is because I want to show that it's accessible to everybody. So if you have an injury, if you have osteoarthritis of your hip or your knee, or you're just thinking about your 84-year-old mom, this is accessible with a chair because it gives you the support. So I'm just going to pick a few poses. Obviously, we do a lot of poses on the floor, but that's not practical right now, so I'm just going to pick a few. Okay? So the first one I'm going to pick is, let me tell you about a couple muscles first, okay? So, to demonstrate how yoga works on the muscles in the bones. There's a muscle called the Sartorius, and Sartor is Latin for tailor. And the tailors used to sit cross-legged. So the Sartorius originates on the anterior iliac spine, or this hip bone here. It's one of the longest, it's actually the longest muscle in the body. And it wraps around and it inserts just below the knee on the inside of the knee, so on the tibia, okay? So what the Sartorius does is it flexes, it abducts, so it flexes, abducts, it flexes the knee, and it externally rotates the hip. Okay, so here we are in tree pose. Now, you can do tree pose with the foot at the ankle. You can do tree pose with the foot at the calf. You want to avoid the knee, or if you have a lot of flexibility in your hip, you can go all the way up. Okay, you can use the chair for support. Now, we want to even out the hips. We want to pull the shoulder blades down, and when I teach yoga, I talk about imagining a string pulling the crown of your head up towards the ceiling. So you create length. So what are we doing here? We are engaging the Sartorius. So we're stimulating this hip bone here. We're stimulating the tibia. We're shifting the weight onto the opposite leg, so we're creating a compressive force. So we're stimulating everything from the pelvis down. And we're also working on proprioception. So remember those proprioceptive nerves that tell you where you are in space? Very important for balance. So this is a good start here. And then, of course, we want to go to the other side. And then, of course, you can do hands here. You can raise your arms up. There's all sorts of ways. Okay. So the second group of muscles that I want to talk about is the iliopsoas. So the psoas muscle originates on the lumbar spine, and it inserts on the upper part of the femur. The iliacus originates in the ilium, which is part of your pelvis. It joins the psoas, and it inserts onto the femur. So they join together. So they're called the iliopsoas. And they're basically hip flexors, okay? So the next couple poses I'm going to do on the chair are the lunge and warrior two. And so you can start on the chair. So here's a lunge pose. So what are we doing here? We're flexing the hip. The iliopsoas is a hip flexor. We're also stretching on the opposite side. We're stretching the iliopsoas, okay? Now, there's a lot of other muscles involved, but I'm just pointing it out to just show you what's going on. Now, when you do the poses, particularly for bone health, you want to hold the pose for probably 5 to 7 deep breaths, which can be, 30 seconds, maybe even longer. What Dr. Fishman noted was that beyond 72 seconds, there's no benefit. But that's a long time, even to hold a pose for it. So I usually say 5 to 7 very deep breaths. In yoga, we talk about ujjayi breath, breathing in and out through the nose. Very long breaths in and out through the nose. Then we can lay the heel down and come into a warrior two, maybe a reverse warrior. Again, we would hold these poses. And then if you want to go ahead and switch sides, you can sit on the chair. and go, again, here we are, stretching out the iliopsoas, engaging the iliopsoas, and then coming into warrior two, reverse. Okay. So that's our demonstration for chair. Now, the wall is really a lot of fun, and you can do a lot on the wall. And the block is your friend. So what the block does is it brings the floor closer to you, or it lengthens your arms, right? So we can start with a warrior two on the wall, and it's really good to use the wall for alignment, so we're not like all kind of folded forward. We're using the wall here, right? You can start from a warrior two, and I'm going to do a triangle pose. So we straighten the front leg, and then we can use the block, and this is our triangle. So as you can see, there's a lot going on, different muscles and stretching, and just, you know, we would be holding those poses for 5 to 7 deep breaths. Now my favorite pose, this is a great balance pose. It's called half moon. So we shift the weight onto the front leg, raise up the back foot. And here you have the wall for support, so you can really be free, okay? So this is a lot of fun, and it feels good to kind of be semi-upside down. And then we'll switch to the other side. So we've got our warrior two, got our triangle, and we have our half moon. So I also wanted to say that if you do have an injury or you have a condition that you're concerned about going to a yoga class and just being kind of one in the class, there's therapeutic yoga instructors that have further training, and they can work with you one-on-one. And most of the studios do have therapeutic yoga instructors. As a matter of fact, I have a free coupon to one of my favorite studios, and I will be happy to give everybody one. So, in summary, we reviewed the osteoporosis definition, how we diagnose it, treatment with medications, and natural treatments, and we emphasizing the importance of what we eat. Our diet is extremely important. So alkalizing our diet will help with bone strength. And then supplementing with vitamins and minerals as needed. And last but not least, the exercise. Now this isn't the only exercise that promotes bone health. I like it because it's accessible to everybody. Everybody can do it, and there's such a variety of different poses that it's such a comprehensive bone treatment. But resistance exercises and Tai Chi, and there's a lot of other exercises that will help bone growth. So when we originally talked about joy, freedom, and mobility, I want you to think about moving. This is very important for our bone health. So remember, to thrive in life, you need 3 bones: a wishbone, a backbone, and a funny bone. Thank you.
Thank you.